Welcome back, everyone. Today I will be discussing my Diabetes Project Part 3, which focuses on the culmination of this project. If we take a look at the various parts of the database, you will see that this database was designed in order to streamline patient care and help healthcare professionals determine which patients have diabetes. This database was designed in a three-part process. The first part was used to create the basis of the database. 4 tables were created, with those being shown here: diabetic event, lab results, medication, and patients. Next, an EER diagram was created, and interactions between the different tables were established. The most prominent interactions that were displayed were the interactions between the diabetic event, patients, and the medications. These 3 were chosen in order to allow for healthcare professionals to be able to establish treatment options as well as to increase patient care overall. The next step was to be able to use the database in order to compare the patient data. By using the subquery here, we were able to take the information of the 20 patients that were generated and select for the specific data that would allow for the comparison of males versus females that had A1C levels greater than 6.4. This was important because A1C levels greater than 6.4 meant that the patient was diagnosed with diabetes. There were 9 patients in total that were generated, with 5 being female and 4 being male. There was no specific reason for this particular instance of separation, other than the randomization of the information. The final part of creating the database was to allow for the creation of 4 users whom all had varying degrees of access to the database. The users, seen here, are the administrator, the information tech, the health informaticist, and the doctor. The administrator has global access to the database, and their assigned role is the owner of the database. This is to allow full access to the administrator so that they can do their job. The information tech, or IT tech, has access to the database in order to be able to create a database backup, as shown here. The health informaticist has limited access to allow the database, meaning that they are able to enter and modify data, but they are not allowed to delete anything, as shown by being able to insert with the tables. And last, the doctor. The doctor has the least amount of access to the database. As you can see, the table is only read-only. Now, if we want to see as to how database access is given, we need to note the following. These are the queries that would allow to be run in order to establish who has access to the database and what level of access that they have. As you can see, each user was given a specific username and a specific password. These are unique to those people and are unique to their corresponding level of access. Now that there are all of the components of the database and they are complete, healthcare providers can start to use this database as a foundation that can be built off of for more comprehensive patient care, particularly in terms of patients with diabetes.